फर्स्ट IVF अनसक्सेसफुल हो सकता है. दिस इज ऑल्सो वेरी इंपॉर्टेंट टू अंडरस्टैंड कि IVF सिर्फ एक प्रोसीजर है.
Once an IVF pregnancy confirmed, does your approach to monitoring and supporting the mother changes?
We would tell them, we would answer their questions which is related to their pregnancy, their complications, and then we would help them to make an informed decision with confidence.
Most important thing whenever some patient comes to us is the emotional counseling and the support. And plus, if we'll talk about the first consultation and their test, then first of all we look at their medical history. Exactly क्या cause है जिसकी वजह से वो conceive नहीं कर पा रहे हैं.
So many questions comes up. We go before talking to the parents. We always talk to a respectful gynecologist, finding out what is the cause, why the baby is coming out, what is the gestational age, is there any risk factors apart from baby coming out, being premature, or any other thing.
Depends upon their married life, the age at which they are approaching us.
When the decision is made to deliver earlier than planned, how do you prepare the mother and family? How do you coordinate with the neonatology team entering the delivery?
They need more emotional support. They want us to be more careful every time. But these days, since IVF has become so common, they also want us not to mention it as an IVF pregnancy every time. And we also want that approach.
Hello everyone and welcome. Today as we celebrate World IVF Day, we are talking about something deeply personal for so many families, the journey to becoming parents. For one couple, it may be the moment they finally see those 2 lines on a pregnancy test after years of waiting. For another, it may be hearing their baby's heartbeat for the first time. At every stage, there are experts who guide, support and care for them. Today we have brought together experts who represent every chapter of this journey, from the first hope of conceiving through pregnancy and birth. When I look around this panel, I see the entire journey to parenthood represented here. We have an IVF specialist, an obstetrician and gynecologist, a fetal medicine specialist and a pediatrician. All the experts that a family meet at different stages of this journey. This is such a power-packed panel and I cannot wait to see what comes out of this conversation. So let's get started. Let's start by understanding each of your roles. Please start introducing yourself, ma'am.
Hi, I am Dr. Manju Gupta, Senior Obstetrician and Consultant at Motherhood Hospital, Sector 48, Noida.
Ma'am.
Hi, thank you so much, Dr. Kajal. I am Dr. Varsha Agrawal, Senior Fertility Consultant, Motherhood Hospital, Noida.
Hello, I am Dr. Archit Singhal. I am working as Consultant Radiologist and Fetal Medicine Specialist in Motherhood Hospital, Noida.
Hi, myself Dr. Amit Gupta. I am the pediatrician as well as the neonatologist at Motherhood Hospital, Noida.
So let's start by understanding the journey. Before we enter a family's journey, what is the single biggest change that you have seen in your specialty during the last 5 years? Each one of you can say it in a sentence or so.
Neonatology definitely has advanced a lot. So like in 5 years back, we were just like saving children who were like 700, 800 grammars. But now it has advanced. We are getting more patient oriented, more family centered. We are able to save with advancement of technology like 500, 600 grammar also. So like parents can expect now that their babies who are born at 500 or 600 grammar can survive. So they have their hope. Now if my baby is born at 24 weeks, still we have a chance to survive.
That's great, sir. Ma'am, please, how have you?
We have found it the change in the way that it is more holistic approach these days. Patients are quite well read. So they themselves help us and themselves also in conception, pregnancy and throughout the journey. It's not very difficult to explain them now these days. If we talk about the pregnancy journey, then also they are quite well read. And if it comes to delivery, then also it's proper birth plan which is made these days rather than just passing an order and following that.
Of course, yes, I totally agree, ma'am. Ma'am, have you seen any changes over
Yes,
last
of
5
course.
years?
The more use of AI these days.
I know
Actually,
you are the infertility specialist, and that's on the.
That somehow is good also, that patients are well aware, they read well and more educated. और मोस्टली उनको पता होता है कि करना क्या है, बट द डिसएडवांटेज इज द myths have also increased, so they have lot of questions, queries, sometimes the myths, so that is somehow
They are not the judges to know what is right or wrong. For that we have you guys. So what changes?
Like Dr. Amit, like Dr. Amit said, कि with use of advanced diagnostic techniques over the past of 5 years and with more expertise, we are able to pick and detect the abnormalities, be it any structural abnormalities, be it any growth abnormalities or genetic abnormalities, more early in the period of gestation, which helps us in planning and finally managing the case very well.
Ma'am, for couples like Rahul and Anjali, the gynecologist is often the first person they approach. At what point do you decide that this is the time to move from general gynecological care to a specialized fertility care? And are there any certain signs or timelines that tell you a couple would benefit more from an IVF specialist?
Yeah, Kajal. So it depends upon their married life, the age at which they are approaching us. Many of the times, patients just approach us at the time when they have just planned to conceive. They have just started planning. Then they have a full. We are ready with the all sorts, and we have full hope that they'll conceive in another few months. We have time, and they'll conceive fast with the treatment, or not even with the treatment, just proper counseling. But when they have already been trying for many years, maybe more than a year or so, and they're more than 35 years of age, then we believe that it is better that rather than wasting time, it is better that they take a specialized opinion so that they conceive faster than wasting time.
Okay, so now ma'am, it comes to you. Once a couple decides to seek fertility care, what does first consultation involve? What questions and tests should they expect, and what usually surprises them?
Yes, the most important thing whenever some patient comes to us is the emotional counseling and the support. And plus, if we'll talk about the first consultation and their test, then first of all we look at their medical history. Exactly क्या cause है जिसकी वजह से वो conceive नहीं कर पा रहे हैं. Their lifestyle changes, what lifestyle they are following. There may be some substance abuse is there, like alcohol, smoking. So all these things, and plus the basic hormonal evaluation, the basic test for the female, the ultrasound for the female to look for the uterus, ovaries, their egg count. And when we talk of the males, the first and foremost important is the semen analysis. So we look for the basic things first, then only we go further.
Ma'am, there is a common perception that visiting a fertility specialist automatically means undergoing IVF. Is that true? How do you decide which treatment path is right for each couple?
ऑफ कोर्स नॉट. और एक्चुअली आपने बिल्कुल सही कहा कि पेशेंट्स को एक्चुअली यही लगता है कि फर्टिलिटी स्पेशलिस्ट मीन्स IVF, बट ऑफ कोर्स इट इज़ नॉट. देखिए 80 to 90% पीपल दे कंसीव जस्ट विद द काउंसलिंग, विद द बेसिक ट्रीटमेंट लाइक ओवुलेशन इंडक्शन, द मेडिसिन, yes, and with the IUI also. 10 to 20% अगर हम बात करें तो उनको IVF की ज़रूरत पड़ती है, या किसी का कोई ऐसा कॉज है जो इरिवर्सिबल है या जिसमें सिर्फ IVF ही कर सकते हैं, तभी हम IVF की काउंसलिंग पे जाते हैं. डायरेक्टली वी डोंट काउंसिल देम फॉर द IVF, एंड एक्चुअली उनको ज़रूरत भी नहीं होती है.
Yeah, that's the important message, that how different are the patients seeking fertility care today from those who you saw 10 years ago in terms of age, lifestyle, health concerns and expectations. I think you answered that before also, but can you expand that more?
Yes, देखिए अभी आप देख रहे हैं कि लेट मैरिजेस ज़्यादा हैं, पीपल आर प्लानिंग देयर प्रेगनेंसी वेरी लेट, एंड एज इज़ द सिंगल मोस्ट इंपॉर्टेंट प्रेडिक्टर ऑफ फर्टिलिटी. सो दैट वी कांट डिनाई, इवन इफ वी आर प्लानिंग लेट और इफ द कपल्स आर प्लानिंग लेट, बट जो बायोलॉजिकल क्लॉक है दैट इज़ नॉट स्टॉपिंग. तो वो जो एक है, प्लस द लाइफस्टाइल, स्पेशली आफ्टर कोविड, द सेडेंट्री लाइफस्टाइल, द वर्क फ्रॉम होम, उसकी वजह से बहुत ज़्यादा इनफर्टिलिटी रेट इंक्रीज़ हो रहे हैं. एंड अनदर वेरी इंपॉर्टेंट थिंग जिसके बारे में हम कभी बात नहीं करते इज स्ट्रेस इतना ज़्यादा है जिसकी वजह से भी फर्टिलिटी बहुत ज़्यादा है. जो अगर आप 10 years पहले देखेंगे तो ऐसा नहीं था, सेडेंट्री लाइफस्टाइल नहीं थी और स्ट्रेस लेवल इतना ज़्यादा नहीं था जो आज है, और प्लस उसके साथ साथ एज बहुत ज़्यादा है. तो ये चीज़ें हमने देखी है जो बहुत ज़्यादा बढ़ गई है, जिसकी वजह से इनफर्टिलिटी रेट्स आर क्वाइट हाई.
Another thing, ma'am, are females asking about egg preservation more nowadays?
Yes, egg preservation provides them autonomy. वो अपनी फर्टिलिटी अपने अकॉर्डिंगली प्लान कर सकती हैं, मे बी ड्यू टू देयर करियर, देयर पर्सनल रीज़न, समटाइम्स इट कुड बी द मेडिकल रीज़न और मे बी द कैंसर ट्रीटमेंट, कीमोथेरेपी ट्रीटमेंट, जिसके वजह से वो भी प्लान नहीं कर रहे. तो एटलीस्ट एग प्रिजर्वेशन से वो जब भी चाहते हैं अपनी फर्टिलिटी प्लान करना, irrespective of their biological clock, they can plan their pregnancy.
Yes. Another, that the point you mentioned in your very first statement, that the emotional side of the treatment, it can be very physically demanding, and couples say emotional journey is even harder. What does meaningful emotional support looks like for both partners during this process?
देखिए, IVF एक प्रोसेस है, ऑफ कोर्स इट इज़ अ जर्नी एंड समटाइम्स इट टेक अ लॉट ऑफ टाइम ऑल्सो. किसी पेशेंट के लिए ये ड्यूरेशन बहुत कम होती है, किसी के लिए ज़्यादा होती है. नॉट जस्ट IVF, इवन द फर्टिलिटी ट्रीटमेंट्स, समटाइम्स दे टेक टाइम, समटाइम्स दे डोंट टेक दैट मच टाइम. तो आई ऑलवेज टेल टू ऑल माई पेशेंट्स कि just have some patience.
And that adds to the stress factor that you were saying.
Actually, that's a vicious cycle. That becomes a vicious cycle. The more you have the stress, the duration would be the longer only. क्योंकि stress भी उससे precipitate करेगी आप बहुत ज़्यादा, and the duration is like that only. It is dependent on the menstrual cycle. So one cycle is equal to 1 month. और वो आपको पता ही नहीं चलता कब वो months they convert into years, and the patient gets even more stressful. So I always say, please take care of your lifestyle. That is the only thing you can do. Nothing else. You can take the better treatment option. You can go with the best medical advice, and rest in your hand is just just following the good lifestyle.
Yeah. So after their consultation, now let's come back to Rahul and Anjali. After their initial consultation and investigations, they enter the process with hope, but their first attempt is unsuccessful. Suppose now what do you help them through that disappointment, and how do you decide what should happen next?
फर्स्ट IVF अनसक्सेसफुल हो सकता है. दिस इज़ ऑल्सो वेरी इंपॉर्टेंट टू अंडरस्टैंड कि IVF सिर्फ एक प्रोसीजर है. वी हैव द किसी भी प्रोसीजर के एक सक्सेस रेट और एक फेलियर रेट है. सबका 100% फर्स्ट अटैम्प्ट में हो जाए ये ज़रूरी नहीं है. ऐसा हो सकता है कि फेलियर हो जाए, लेकिन उस फेलियर को हमें लाइफ का फेलियर नहीं मान के उसमें आगे बढ़ना इज़ मोर इम्पॉर्टेंट, बिकॉज अल्टीमेट गोल इज़ टू गेट प्रेगनेंट. तो उसमें आगे कैसे बढ़ना है. एंड जब भी कोई पेशेंट आता है जिनका पहले फेलियर हुआ है, तो वी अगेन रिव्यू एवरीथिंग, द मेडिकल हिस्ट्री ऑल्सो, द प्रीवियस ट्रीटमेंट प्रोटोकॉल, एंड वी मेक द चेंजेस इन दैट कि उसको हम और क्या बेटर कर सकते हैं. एंड देन व्हेन वी गो विद अनदर साइकिल, डेफिनेटली द पेशेंट्स, मेनी पेशेंट्स गेट देयर रिजल्ट इन देयर सेकेंड और इन देयर थर्ड अटेम्प्ट.
Okay. So there is a lot of stigma also. When a couple enters a clinic, they may have heard many conflicting things from family, social media, and the internet. What is one myth about IVF you wish would disappear for good?
हाँ, मैं तो यही बोलूँगी कि ये सारे पेशेंट्स यही पूछते हैं कि IVF का बच्चा और नॉर्मल बच्चे में क्या फ़र्क है, कि IVF का बेबी हमारा ही होगा ना, कि वो किसका होगा. सो आई बिलीव और आई थिंक कि ये ज़रूर एक क्लैरिटी आनी चाहिए कि IVF बेबी और नॉर्मल बेबी भी सेम ही होते हैं. वो भी आपका ही बेबी होगा जैसे नेचुरल कंसेप्शन के बेबीज होते हैं. यस.
Okay. After their first attempt is unsuccessful, Rahul and Anjali take time to recover, speak with their doctor, and decide to try again now. This time they receive the news they have been waiting for. They are pregnant now. For a moment, it feels as though they have finally made it, but very soon a new set of questions begin.
Yes, definitely. They need more emotional support. They want us to be more careful every time. But these days, since IVF has become so common, they also want us not to mention it as an IVF pregnancy every time. And we also want that approach to be followed because it is so common, and still it is considered as a stigma. So they don't want to be labeled as an IVF patient. So what we generally do is, it's not that we monitor them more, but yes, if there are any comorbidities, as if it would have been in any natural pregnancy, we follow them like that only. But yes, if it is a multiple pregnancy, they are carrying 2 babies or more than that, then yes, more monitoring or monitoring as per that is required. Else we take them as a normal conception.
Another question, ma'am, for you. Many couples who conceive through IVF wonder, does needing IVF mean something is already wrong? Is every IVF pregnancy considered high risk, and what does high risk pregnancy actually mean?
See, as I said, IVF has become so common these days, so we don't consider IVF pregnancy anymore as a high risk pregnancy. Sometimes people do, or patients do have this in mind, that since we are an IVF conception, so we are a high risk pregnancy, and if we talk to the delivery, we need special care, or we need to deliver in a multi-speciality, or we'll be requiring only the cesarean section at the end. So this is the myth which we should break these days, that since it has become so common, so despite it is not being a natural conception, you can very well go for a natural vaginal delivery. Apart from that, it doesn't become a high risk pregnancy just because of it being an IVF conception. So unless and until they are, as I said earlier, we don't take them as a high risk. Yes, we don't take them as a high risk pregnancy.
My question to you, sir, for parents hearing the term for the first time, what does a fetal medicine specialist do, and at what stage do you usually become involved, sir?
So basically, we as a fetal medicine specialist focuses on the growth and the overall development of the baby. We do the scan thoroughly. We look at in every scan, we look at the organs, the growth of the baby. We do a regular growth monitoring, and we work in close association with the obstetricians to make sure that the baby and the mother has good outcome.
Okay. Now for these parents, every scan is an emotional milestone, like they got their first heartbeat or something. What are you looking for during the important scans, and how do those findings help guide the pregnancy?
So every scan in the pregnancy is important, right? In every scan, we look for the organs, internal organs of the baby, for the growth of the baby, the blood flows of the baby, and the overall well-being of the baby. If we see that the baby is not growing well, we keep that baby on a regular follow-up. We do a proper growth monitoring, and if we see that there is some finding in the baby, we bring in the specialist, and we do the timely management. We do the timely delivery, just to make sure that the baby is perfectly safe and healthy.
Okay. Now coming back to their story, at 20-week scan, the doctors notice a small finding in the baby's heart. They explain that it may resolve as the pregnancy progresses, but it needs monitoring. For Rahul and Anjali, even the word small finding is enormous, I think. So when a scan identifies something that may resolve but still requires monitoring, how do you explain that uncertainty without either frightening your patient or giving them false reassurance?
So it's a very common thing that we see during a level 2 scan. We call it a normal calcium deposition in the heart. सुनने में ये बहुत बड़ा finding लगती है, but
they feel it's something in the heart of the baby.
Yes. But we always tell them that it's a very common finding, and it generally resolves on its own. We just need to keep them on a regular monitoring. Mostly ये जो scan findings हैं, ये over the time अपने आप resolve कर भी जाती हैं. So we just generally try to assure the patient without giving them any false hope, and we always tell them कि eventually these are going to dissolve soon.
Ma'am, sir, and you both can answer. When a scan raises a concern, how do you and sir would work together to monitor such a pregnancy and guide the family through next steps? Sir has already told you would counsel them. Anything from your part, ma'am?
See, we tell them with the ratio that this is the percentage we find this, and so many patients with the similar findings have been delivered, and no such effect has been seen on the baby. This is such a common finding. Yes, it is not IVF related. Definitely, many of the times it comes up that is it because of the IVF that our baby is having this. So most of the times the findings are very subtle, which do not even require any monitoring or any care later on. So it is very important from our aspect that we tell them that you should not just bother about this finding. You can very well neglect this if it is actually a subtle finding. If it is something major, then also it comes from us that you need not worry about the finding, because we'll be monitoring it. Many of the findings, they resolve, or even if they do not resolve, they will not affect the baby. If the finding is something which will affect the baby, then most of the findings these days are, since we have advanced so well, the science has advanced, so they are treatable causes. So we tell them the example, we further refer them to super speciality if there is anything major related to the heart of the baby, or if there is anything which is something genetic related, then further testing is being done, but reassurance is what they demand from us. So first test, which actually has scared them, so the thing which comes from us is that this is quite common these days, not IVF related for sure, and they should not worry about it till we have the further test done.
when the mother's condition and baby's need begin pulling in different directions, as with high BP and slowed fetal growth, how do you decide whether to continue monitoring or recommend earlier delivery? Sir, you can.
So basically, pregnancy is a team effort, right? The obstetrician looks at the clinical condition of the mother, and we as a fetal medicine specialist focuses more on the growth aspect of the baby. How is the interval growth of the baby? If the baby is growing well or not. If we see that the baby is growing well and the Dopplers are normal, we plan to continue the pregnancy with, of course, a closer follow-up. Sometimes it can be weekly, it can be bi-weekly, or it can be an alternate day. But if we feel that yes, the baby would be better outside the womb, so we take a timely call and we plan to do the delivery.
So it's a coordinated decision, obviously. Now, sir, I would like to ask you again. These days, parents have access to genetic testings, detailed scans, and online resources. Has this helped them feel prepared, or is it just creating extra anxiety to them?
Of course, more information on the internet has given them more awareness about the conditions, but simultaneously, it has also given them more anxiety. The parents nowadays, they are like so much into the chat GPT, into the Google, that they will often read something which is not at all related to their situation also, and they would start worrying about it. So as a fetal medicine specialist, we would often reassure them, we would tell them about the findings that is pertaining to their pregnancy that would help in their pregnancy and not the
With social media and all this start to compare also, and everything comes in.
So we would tell them, we would answer their questions which is related to their pregnancy, their complications, and then we would help them to make an informed decision with confidence.
When Anjali's blood pressure rises and baby's growth slows further, the team decides that an early delivery is the safest option. Until now, the focus has been on protecting the pregnancy. Now, the obstetrics and the neonatal teams must prepare together for the baby's arrival. So, after months of waiting, monitoring, and hoping, Rahul and Anjali had finally reached the day they would meet their baby. But the journey did not unfold exactly as they had imagined. With Anjali's blood pressure rising and baby's growth slowing, medical team decided that delivering at 35 weeks is the safest path forward for mother and baby. Ma'am, when the decision is made to deliver earlier than planned, how do you prepare the mother and family? How do you coordinate with the neonatology team entering the delivery room?
See, since the patient already knows that her BP is rising, it generally is not a very difficult task for us to counsel them that yes, it is the D-Day and we are planning for not 37 or 38 week delivery, we are planning a preterm delivery for them. So we make them have the confidence in our neonatology team that we tell them that we have already done this earlier and your baby is in safe hands. Our neonatology team is very good. We tell them about our NICU and their success stories. This gives them confidence, and when they are confident enough that yes, they are in safe hands, it is easy for us to tell them that it is the womb is not very safe for them, neither for the mother. So it is better that baby comes out. So this way we disclose the news, though we have been preparing them, but sometimes it does come as a shock to them that they somehow have false hopes that despite BP being rising, despite baby not being growing so well. So in accordance to neonatology, fetal medicine team and we all together, we tell them that this is the time when baby should arrive and baby will be further taken care of by them and through neonatologist.
Them to sir also
yes, for neonatal counseling, preconceptional counseling.
Yeah, like this is the very important, like an emotional part we always feel. But somehow, like in motherhood, we have very good gynecologists here. They always make a team with us. We as a team go and talk to them. So our 90% work is being done by a reputed
Ma'am would say the same for you, sir.
so they always counsel them.
It is like passing on the buck.
But yes, it's a very high like emotional time when we generally go and talk to them. When you must be scared like my baby is coming out, the baby will be in an ICU or not. So many questions comes up. We go before talking to the parents, we always talk to a respectful gynecologist, finding out what is the cause, why the baby is coming out, what is the gestational age, is there any risk factors apart from baby coming out, being prematurity or any other thing. is there a twin pregnancy or a triplet, or it's just a singleton? So multiple questions comes out. We sit down with parents, all dada, nani and everything. We sit down, we try to talk, try to convince them, try to let them know that an ICU is just the next safe home. It is just like a womb from where the baby will go out to you. So this is how we do it.
Okay, sir. So now the baby is born. What are you assessing during baby's first moments, particularly when the baby is premature or has a low birth weight?
So once the baby is born, it's a preparation which is very important. So once the baby, we get to know all the information, we always make sure that our OT room should be prepared for the baby. We have a warmer there, we have all the essential monitors there, we have all the breathing equipments that we need. Baby comes out, we always look, is the baby breathing or not? Is the baby taking properly? Baby looking blue or not? Baby heartbeat is fine? Baby moving all the limbs or not? So if we feel the baby is fine, we do something known as delayed cord clamping. A gynecologist is really nice. She always prompts us, do a delayed cord clamping, and we always do it.
Okay. Yeah, people are reading all those things.
So they are knowing about it, which is good. Somehow AI is also helping us in a way.
Yes.
So once the baby comes out, we try to, this like first hour is very, very important. We always call it as a golden hour. So the first hour we try to put the baby on the mother's chest for the bonding. Once the baby comes out, we always make the baby is coming out, we always make the attendants come in. They should know the sex, they should know about the details about the baby, and then we take the baby to ICU.
So Rahul and Anjali have their daughter now. She is born at 35 weeks, weighing 2.1 kg, which I think is a good weight for you, sir, because you said you were saving 500, 600
No, I am not saying
grams
it's a
now.
teamwork which saves.
Obviously.
It's not me.
Because she needs support for breathing, feeding and weight gain, she is now admitted to NICU. For Rahul and Anjali, those 4 words of NICU creates a wave of fear. So when parents hear that their baby needs NICU care, they may assume the worst. What does NICU admission actually mean, and what do parents commonly misunderstand about it?
So ICU scares everyone, whether it's an ICU or pediatric ICU or anything. So we always let them know, since your baby is approximately 2 kgs, we always go with guidelines. We always take the baby inside of an ICU. We see, is your baby breathing fine? Is your baby doing good? Is the parameters okay? His SpO2 is fine, his oxygen saturation is fine. Baby is doing nice. If we feel our baby is doing nice, we generally don't keep it for more than 3 to 4 hours. लेना है, उसको अंदर रखना है, मदर के पास फीड कराना है, and then just monitor vitals and transfer. But this is an important part where we see, is your baby breathing or not nicely? Is he having any distress? क्या उसकी सांस सही चल रही है? These are small things which needs to be monitored. Always a transparent calling between the parents is very important. We tell them कि ये हो सकता है, this we have to expect. So emotionally high, but we have to calm down, let them know. Do one meeting once the baby is born. In next 3 to 4 hours, just sit down with them. If the baby is getting admitted, why? Show them, be transparent, be honest, and then take profit.
Yes. I agree, sir. That's the most important thing. Now, what milestones do you watch for such baby before you feel that the baby is ready to go home?
There are a couple of things we always put. So an ICU means not only like this 2 kgs baby. There could be babies who are born at 600, 700 gram babies. These are the babies who might need ventilator, who might need respiratory support. They are with us for approximately 2 to 3 months. So it's a long journey for parents. Always an open communication. So once these babies are getting discharged, they are at high risk, being with us for approximately 2 to 3 months. So a preparation before sending home is very, very important. Once the baby gets stable, the parents gets involved with us. They get to know how the baby is, how to feed the baby, what parameters to look at, how we train them to see what are the danger signs before they take the baby. Once the baby is getting discharged, we make a list of things. We make them the follow-up. This speciality needs to be seen, this speciality needs to be seen. these are the vaccination you need to do, these are the eye issues, these are the brain issues, this all needs to be followed up. So we all do like that.
When, sir, I would like to ask you again, when is a baby ready to leave neonatal care? You already told. And what information must pass to the pediatrician if they are following up with someone else who the child receives right up after their NICU stay?
So as we talk, we make a detailed case summary wherein we are writing everything like XYZ, how did the baby be received and what are the whole journey throughout the NICU. So once the pediatrician see this, he gets to know. He is aware of all the things, what are the things happened up, so he can plan out neurodevelopmental follow-up or an eye visit or a brain visit. For these things, different doctors needs to be seen.
After years of waiting, fertility treatment, a closely monitored pregnancy and an ICU stay, Rahul and Anjali finally bring Anya home. But the questions do not necessarily end at the hospital door. Is our baby growing well? Is an IVF baby medically different? Are we missing something? Are we doing enough? This is where the pediatrician becomes part of the next chapter, supporting a child's long-term growth, development and well-being. Sir, when a baby like Anya comes home from neonatal care, are any special points that you look at in the child when she visits you in the OP?
So as we talked, it's a detailed summary. Whenever the baby like this comes up, these babies needs to be monitored for weight, for length, for subtle sign of developmental issues. A proper workup like their eye workup, their hearing workup, their brain workups, all needs to be taken care of. You have to see, is the baby feeding or not. You have to pick up subtle signs of neurodevelopments which can be missed by parents. According to the parents, my baby is growing nice, but there is some subtle signs of deficiencies, maybe iron deficiency, maybe a child is showing some subtle signs of maybe like tightness in the hand, so maybe like some neurodevelopmental issues. So these small things needs to be checked.
Sir, from your perspective, is the IVF baby medically different?
No, a big no.
I would like to emphasize this question, and as ma'am has already told, this is the biggest doubt.
Yeah, they are a little pampered one because after 10 years of thing or 7 years it's been happened, but they are totally.
Sir, another thing, parents like Rahul and Anjali are now very alert to every fever, feeding issue, delayed milestone. How do you make them understand what needs medical attention and what may be the normal growth thing?
First of all, as we said, your IVF baby is just like a normal baby. Every baby, if one has to fight, they are out to get infections, cough, cold, loose motions, diarrhea is out to happen. It cannot stop. This is how they say my child's immunity is weak. I say their immunity is happening out. Immunity ban rahi hai. Yes, but an important factor, if there being a stay in an ICU, they should be looked for subtle neurological signs.
So I would like to interrupt you, sir. Has there been an incident where regular pediatric visits helped in diagnosing a case when the early signs might have been missed by the parents at home?
Many times it happens. So recently, like there was a baby who was born in our NICU with a brain grade 2 bleed. Respectable ma'am's babies only. So came with us and I was doing nice. At approximately 7 months of age, was following it nicely, but I feel the right legs was not moving as per me. There was some tightness in it. I sent it to our colleague, neurodevelopmental doctor, and there was a subtle CP, cerebral palsy. But luckily, it was picked up nicely at the right time, and the baby is now approximately 1/4 to 2 years, and everything is fine.
Okay, that's great. That seriously means that you need to visit your pediatrician regularly. Sir, last advice from you after caring for so many children and families, what advice would you give to every new parent?
Give your time, and that's it. No screen.
And
lot of time. Get involved in the care, and that's it. Please, it's not the mother's duty, it is parents' duty. Always remember this. Father plays a very important role, mother plays an important role. It's a collective effort to take care of a child.
So, through the story of Rahul and Anjali, we have explored the uncertainty of trying to conceive to pregnancy, birth, neonatal care, and childhood. At every stage, a different specialist carried part of the responsibility and then passed it forward. Before we close, I would like to bring a rapid fire to all my specialists. Ma'am, you can just tell me, with respect to your field, what would you made it mean in your, like if you want to say you made it to your patient, what would that mean for your patient?
Having a healthy baby at the right time with the mode of delivery which best suits them is what I say I made it to them.
Okay, ma'am, Varsha ma'am.
I think healthy baby and healthy parents and
So
happy.
that's the ultimate
Yes.
goal for everyone, I think.
Goes the same. All the scan findings are reassuring. We're not finding any abnormalities. Everything is going smooth. The baby is happy, the mother is happy, and the father is happy, and the doctors are
Lot of
happy.
time. I always believe in lot of time.
And sir, anything that the parents can do when the baby stays in the NICU, anything
Again,
that
I
they
am saying
can do
again,
for connecting with the baby?
Again, one word, lot of time. So it's like nowadays it's a family-centered NICU. Okay, so we get to
Okay.
take the parents in, make them involved in the daily course of the baby, like
Mother can
changing.
come in
Yeah,
and- yeah.
kangaroo mother care is a wonderful thing where she is attaching the baby to herself. She's getting involved in the daily routine of the baby. So in a one word, I would say again, give time.
Okay, so I'll thank you all for sharing your medical expertise and the communication and compassion that you show towards your patients. Today we have seen that you made it is not one finish line. To every family watching, wherever you are in your story, your journey may look different from someone else's and it may not unfold as planned, but you do not have to walk it alone. We have the experts around always. Every step matters, every milestone matters, and with that I would say happy World IVF Day. Thank you all.
Thank you.
It was nice to have such a knowledgeable panel with me.
Thank you.
Thank you.